So my name is DaCosta. I've been working at Stevenson now since September. Coming September, it will be 3 years. Well, I'm a RN, so I work in the emergency department. So I do different roles like team lead, triage, and just working in the main ED. Well, it's definitely unpredictable, but I've worked in ED for the last 26 years, so unpredictable, I know. I think this being a small hospital helps a lot because coming from a bigger hospital, you see so much. Just being in this small hospital, I think it's much more controlled. But you have to come from a bigger hospital to understand that. Well, when I'm TL, of course, I try to make sure that I'm supportive to the rest of the staff and to ensure that I give them feedback. I try to do a little bit of teaching here and there, especially to the junior staff, and just to ensure that everybody is managing and feeling supported throughout the day. We have your best interests at heart, and we don't like to make people wait. Unfortunately, with the current system in Ontario, in anywhere in Canada, and I believe that this extends to different parts of the world, it's a waiting system. Unfortunately, people have to wait, and because people have to wait, we have to prioritize them based on what we call the CTAS level. And we use that kind of CTAS level to kind of sort through patient to figure out who is more safe to wait. So it's never because we want you to wait. We want you to be happy. We want you to go through the ED with a good experience. But unfortunately, sometimes you have to wait. However, I hope your experience is that when you do come to the ED and you have to wait, you feel comfortable to come back to us to tell us how you're feeling. If something changed, let us know. And also, we will do whatever treatment we can in the waiting room just to make sure that you're comfortable. I came from big hospitals, right? And I've traveled also outside of Ontario to work. I've traveled to different provinces, and I've worked in one of the what would you say, the busiest ED in all of Canada. And so I live in around here, and I've traveled for the longest time back and forth to my destination. And this was, of course, at a different time in my life. It's been a long time I've been doing this, and I'm tired of traveling, but I also like the idea of finishing it in a small community hospital because I did start in one. So when a patient comes in and we understand what their needs are, we want to meet that need. And we're going to try everything we can to meet that need. And sometimes we understand that we might not be able to meet that need, but we will work with the patient to ensure that they understand that and see how we can work around to come as close as possible to meeting that need. So that's what that means to me.